Welcome back to this NPTEL course on Essentials of Sports Injury Prevention and Rehabilitation. So, towards the final week 8, I'll be covering on return to sports and long-term prevention. We saw about the part 1 earlier. Now we'll move further ahead on part 2 of this particular module. And you're with me. I am Dr. Chandrasekhar Guru. I'm a sports medicine specialist, assistant professor in the field with Armed Forces Medical Services. So during this module, you've learned in the previous part about return to sport concerns, how to make RTS decision making, what's the approach, and the framework, the START framework used for return to sport decision making. In this part, we will discuss about return to sport and re-injury prevention. So to revise what we have discussed in the previous part, we discussed about different phases of rehabilitation. We discussed the concerns of return to sport and the problems associated if the return to sport is improper. We advocated that decision making process should be a team based approach with proper criteria based approach. We also dwell in detail about the strategic assessment of risk tolerance framework and a case scenario to substantiate the different stages that you include in your return to sport process. We also saw what determines the variation in terms of the return to sport, the factors that determines these variations with respect to different individuals, and what you must do in case nothing is going right for you during a rehab process in the return to sport decision making approach. So in this part, we will dwell upon the return to sport strategies that you need to consider to prevent re-injury risk. So we know that rehabilitation program takes place in phases. Phase 1 involves acute management, phase 2 is mainly the tissue healing process. Phase 3 is replicating sports related specific demands, that is the tissue stressors. Then in phase 4 and phase 5 you address the return to sport decision making with good criteria based approach, and then in phase 5 we incorporate the prevention aspect for re-injury so that you have a long-term injury prevention program incorporated in the athletes training macrocycle. So we are focusing on the challenge of when to RTS. This we have discussed in the previous part. Now we will discuss about how to prevent re-injury risk in such individual who are made fit for return to sport after an injury. So the decision making process involves 3 stages, and the stages here are the tissue health assessment, which involves the demographics, the symptoms, physical examination and the physical signs. The step 2, which includes the sports related factors like the sports being played, the position, the competitive level of the athlete, ability to protect, functional tests that you would have with respective criteria on the normative data, and the psychological readiness. Step 3 involves the assessment of risk tolerance, which are predominantly the factors that decide the return to sport decision or influence the return to sport decision. These are the stage of the season in which the individual got injured and he is now in a state to return to sport, pressure from the individual as well as from the external authorities like the coach, the federation or the sponsors, conflict of interest and the fear of litigation. However, in certain cases there may be re-injury. So what predisposes is respective of a good strategic framework that you have re-injury. So the probable factors attributed for re-injury after a successful return to sport are premature return to sport. So at the first stage itself, you made wrong in the decision in terms of prematurely returning the individual to sport. Insufficient rehab. the rehabilitation has been insufficient probably at the step 1 itself, and the risk factors along with risk factors are still present that the individual has suffered a re-injury. That means that the risk factors have not been addressed, and the most common risk factors that is to be addressed during the program is the mechanism of injury or the biomechanical factors which have not been addressed. So these are the common factors that lead to an injured athlete returning sport to again get re-injured. So why we need to prevent after all re-injury and why it is key? Because previous or past injury in an individual is a definitive risk factor for occurrence of a re-injury, and this has very good level of evidence. Say the most common of the sports injury is the ankle injuries, and in ankle injuries the chances of re-injury increases by 4 times than non-injured ankle. Even more so in the initial phase after return to sport, that is between 6 to 12 months, the chances of recurrence on the same ankle increases by 10 times. It's very alarming. Coming on to the hamstring injuries, more common in sprinters and footballers. We have in soccer players, there is a study which have shown that the increase of re-injury increases about 5 to 7 times. This is well documented. With respect to the knee injuries, the previous ligament injuries predispose the individual for ACL graft re-rupture. It can also cause a contralateral injury because of the shifting in the force onto the normal limb, and also injury to the other knee structures. So that's the kind of importance that a previous injury has, and hence it is important to prevent this so that the individual is not having a major impact because of the injury. So this can be easily made understanding using this injury causation model. Injury causation model was adopted from the epidemiological model of Mavis et al., wherein the internal risk factors leads or predisposes an athlete, and in presence of an external risk factor, this predisposed athlete becomes a susceptible athlete. When such a susceptible athlete is exposed to an inciting event or a sport specific situation, that may end up in occurrence of an injury. I am sure that this particular model would have been amply described by the other faculty during the progress of this particular course. So I am here to reiterate that the internal factors in terms of previous injury also predispose an athlete here. So it's important that we target the previous injury aspect of it during the rehabilitation of that particular injury. The external factors and the inciting event, especially inciting events in terms of the biomechanical factors, or the mechanism which is commonly attributed to, is if present can again cause a re-injury risk. So how do we prevent injury? So this conceptual approach is already been discussed earlier. The approach is to establish for any injury prevention program, it is important that at the first stage to establish the extent of the injury. So we need to know what is the extent to which the injury is happening in that particular team or particular group of people, or in our case, in this case, to that type of injury, and based on that establish the mechanism. The step 2 would be to establish the mechanism and the various associated risk factors. So easy would be to fall back onto the Mavis injury causation model, and it lists out various factors that would contribute for the individual to predispose an individual to develop an injury. So these factors and the mechanism which would have been contributing factors in occurrence of an injury should be studied in depth. Once these factors are identified, studied and addressed during the rehab program, we need to go and introduce a preventive measure. So preventive measure or a preventive program, injury prevention program, once introduced, it is not the end of it. Thereafter, it needs to be regularly monitored and assessed. using the same stages so that you finally keep the individual injury risk free. So the conceptual approach is given by Van Mission et al. So in case of rehabilitation and injury prevention, let's focus where these different 4 stages fits in the phases of rehabilitation. In phase 1, that is acute management, the establishment of or the extent establishing the extent of the injury comes into play. So during the acute management phase, you need to identify the extent of the injury using probably the clinical diagnosis or in some cases imaging modalities to exactly identify the extent of the injury. The various factors and the mechanism which should have led to the injury has to be studied during phase 2 and have to be incorporated to address these factors during this rehabilitation program. So phase 2 and phase 3 will incorporate or address the issues that you have studied which would have led to the occurrence of that injury. In phase 4, when you plan for a return to sport decision, during this is the time when you introduce a preventive measure. So you already have a laid down structural criteria based progression of return to sport decision making process, right, which we discussed in the previous part. So include the preventive measure that you have designed based on the various factors that would have caused the injury, and then accordingly you will have to introduce that into this particular decision making process, so that you already have an idea about the how well the injury prevention program is kind of helping out in assessing the functional outcomes. And finally the phase 5 would be the assessing the effect of the effectiveness of the injury prevention program during the prevention of re-injury phase. So what are the various steps that you take or incorporate in your injury prevention program? First thing first, you always need to incorporate the general injury prevention principles. I'm sure all these general injury prevention principles would have been covered in depth in the previous modules. However, I will just list out these important principles that one need to kind of again and again reiterate and implement in the injury prevention program. The first thing that one should consider is the playing field and the equipment, the surface, environment and the sport equipment. All those have to be maintained and they should be injury risk free. Second important aspect is warming up before the session. So it is important that proper preparation of the organ system and the muscle and the region has to be undertaken following general warm up as well as the specific warm up principles, and that needs to be carried out before every session, including the inputs of the strength and conditioner coach. Third important point is the desired level of conditioning. So you need to have a base level of conditioning before progressing to sport specific demand. That needs to be there with respect to the strength, the agility and the endurance or any other type of motor quality that is specific to the particular sport. And it is always important to reiterate to the athlete that the individual should always wear the protective equipment, even though if it is a practice session also. This will prevent the occurrence of an injury. And the most important is always prevail on obeying the rules and game safety, because it is easy to overlook these aspects during training session, and these would end up in an injury or a risk of re-injury. So this particular thing is very important. So for example, in combat sports like boxing, it is easier to get kind of because of lack of same age and weight category opponents, you can have a different category person practicing with another category, different weight category. So this itself, the imbalance or the inequality between these two skill sets can end up in occurrence of an injury as such. So such things should be avoided even though it is a practice session. And the last one is these programs have to be periodized with the training program, and it is important that the major factors which contribute to the overall well-being of the athlete in terms of sleep and nutrition has to be monitored. So by abiding by these simple practical considerations, one can easily prevent occurrence of injury. In addition to this, it is important that in the injury prevention programs, we need to plan them to fit them into the regular training schedule. It is not that injury prevention program or a specific athlete who is injured and returned to sport should be treated separately. It also has a major psychological impact on the athlete as well. At the same time, it is important that it should whatever the targeted approaches or the injury prevention program has to be part of the training program per se, so that the individual themselves feel part of that program, and then they abide by it and have a disciplined way of addressing to these programs during the regular training sessions. They should be designed to address the strength, coordination, and clearly sport specific skills. So the injury prevention program that is being designed should address this basic qualities as well as the sport specific skills, and generally they are given at an intensity slightly lower than the competition intensity, but then higher than the warm up intensity, so that the individual at the same time is also prepared for the competition or for the main sports specific demand. The main aspect of this injury prevention program is to increase the neuromuscular coordination. So as we all know, scientifically, with injury there is deterioration in terms of the neuromuscular coordination as well. So even though we would have addressed these aspects during the rehabilitation program, and then only we would have taken a considered decision of returning the individual to sport again, back to the sport. It is important that this particular part continues even after returning to sport. You could see in most of the athletes after returning sport, they lose track of these drills and the programs that are incorporated during the rehab times. So that also predisposes them to re-injury chances. And the sport specific skills which we introduce in the injury prevention programs, they should be more concentrated towards the biomechanical factors which would have led to the injury or the mechanism. So commonly it is the jumping mechanism in case of jump sports, landing techniques that needs to be integrated, so that appropriate strength development as well as the reaction and coordination also happens when the individual actually goes for landing. Also sidestepping maneuvers commonly seen in the FIFA program, wherein you have the FIFA 11 warm-up program, which includes all this drills which are specific for the sports, as well as the postural reaction that needs to be considered to negate the side-to-side difference. Another important aspect of injury prevention is cool down and recovery, whereas the cool down session should provide adequate time and circulation for clearing the waste products that is accumulated during the exercise period, and this would also prevent sudden blacking out, and that itself could pave way for occurrence of an injury because of postural hypotension. So that can be avoided if there is a staged cool down session, gradually reducing the heart rate and the other physiological responses. The advantages that I have listed here is you can use this particular cool down session as a time to interact with the athlete and get to know about the list of injuries that they would have sustained during the practice session, or in case any aggravation of any particular symptoms can be utilized as a debrief session also to increase the rapport between the athlete, and also can be used to provide appropriate nutritional support immediately post workout. So that's the thing that is related to cool down session. With respect to recovery, obviously the recovery part is important to keep the individual away from the injuries. So that includes your nutritional aspect, sleep strategies, and Other external aiding methods like massage, sauna, and steam sessions. These can also help in rejuvenating and recovering from the uh, stresses of the training. For the use of right protective equipment, so you need to comply first of all with the rules of the sport. The protective equipment which you would be using to protect the injured part from getting re-injured has to comply with the rules of the sport. So that is first and foremost, and accordingly a suitable equipment has to be chosen which is specific for particular sports size and age of the athlete. Sometimes it is seen that these are readily available over the shelf, over the counter, so you buy them and then you find that the relevant size is not there, it is not properly fitting. So such an equipment is not going to protect further, rather it would result in occurring of a new injury as such because of the improper size as such. Say for example, footwear commonly which happens with the choice of shoes. So it is important that these equipment should be properly fitting and they should be to a major extent customized for that particular region and for that particular age and sport position the individual is playing. And it is also important to monitor the status or the condition of the sport protective equipment, whether they are worn out and whether they require any replacement at crucial junctures that needs to be carried out. This, by using this appropriate equipment, it is not only focused towards competition, it should be used throughout the training. It should be used even during training as well as during the competition, so that the individual can have comprehensive protection. So the commonly used protective equipment are the tapes, adhesive tapes that are commonly used in case of various shoulder injuries or superficial ankle sprains, grade 1, grade 2 ankle sprains, even after rehabilitation to prevent re-injury of ankle sprains. Over the shin and the leg, you use guards. Over the wrist and elbow, in cricket you use guards, gloves. You know, you also have specific guards to cover your shoulder and the chest. So in sports like rugby or American football, eye protectors, say to get the protection of the eye from sudden sudden impact of the ball, say for example in squash or in case of cycle riding. Use of helmets, again protective, commonly used protective equipment, and as well as the gloves and mouth guards. Mouth guards, again an important aspect, especially in combat sports like boxing, where the mouth guards has to be generally they are available over the shelf, but then they may not be of right fit. So it's important that you need to have customized or right fit mouth guards which should be used. Same goes with the gloves as well, and as well as the footwear. So why should the injury prevention focus should be on? It's because the focus of this particular injury prevention program is on the weakness that you assess during the rehabilitation program, and the weakness that has happened because of the impairment of the injury per se. The motor qualities also during the process would have got degraded over a period of time, and because of the injury, as I said earlier, there will be alteration in the neuromuscular coordination and muscle activation patterns that needs to be addressed. The other risk factors that would have resulted in the injury, like the improper landing technique or maybe improper takeoff or improper maneuvering of the ball in footballers. So these are the factors that needs to be cutting movements. These are the factors that needs to be uh, taken care of while addressing the injury prevention program. And the injury prevention program should be targeted towards the injury per se and as per the factors that is around the individual who is injured. So to summarize, the RTS decision making is as such complex, but then should be more athlete centric, considering the physical as well as the mental state. The re-injury prevention program should be incorporated as a continuum in all the phases of rehabilitation. Functional assessment when you do for return to sport should also include the re-injury risk related activities. It is important to address the other risk factors that would have contributed to the injury in your injury prevention program. Injury prevention program is long term and it should not be short sighted with only focus during the rehab program. It should be continuing with the individual even after returning to sport. And the program should also have a multidisciplinary approach so that most of the risk factors are addressed from various ends. So for those of you who are interested in in-depth study, can refer to these resources which is available. Thank you.